So if I could just tell you for a start a little bit about who we are as Active Lancashire. So Active Lancashire, we're a charity, but we're also a company limited by guarantee. We're part of the Sport England family, and our role is to increase participation in physical activity and movement. And we're really targeted on communities facing the greatest inequalities. And we're really trying to make an impact on those big ticket items, those big structural challenges for Lancashire about economic productivity, our health indicators, and we see our role in terms of leadership and development. So a lot of what I'm going to show you today is very much about our partnership approach and pulling together partners at a local community level. So a lot of them voluntary sector organisations and local government bodies who can actually deliver improvements in workplace health. And our project is called Business Health Matters, and I hope you can see the logo on the top right hand corner. And there are 4 key elements to it: employer engagement, the health screening work, which we do. If you've done an over 40s health check, it's development of that. Tailored interventions, which is a bit like social prescribing, if you're familiar with that. But one of the key things that we're doing is we're trying to understand how this actually helps businesses and individuals themselves to improve their quality of life and their productivity. So Laura, next slide, please. Thank you. So colleagues before, particularly Peter, you've really started to articulate that argument as to why health and productivity absolutely go hand in hand. But to give you some, sorry about the vehicles going by, to give you some really big statistics, we know that people prematurely withdraw from the workplace in Lancashire, and if we were to get our the over 50 working age population back to the UK average, we'd have to actually get 24,000 people a year over 50 back into employment just to be at the UK average. And in terms of health, we know from the research that's been undertaken from the Northern Powerhouse by the Northern Health Science Alliance that poor health contributes to around about 30 to 50% of that GDP gap, that underperformance in Lancashire. And for us, that amounts to around about £650 million a year of lost productivity down to poor health. And just about half of that is around mental health. Thank you. I'll just move on to the next slide. So it's really good to see that those figures and health and productivity is being considered in the Lancashire Independent Economic Review. As I said, our focus is really to pull together local partners to develop this delivery chain, and we're really keen to use voluntary sector organisations and local government partners. So you will see here familiar names, I hope, like Mind and Leisure Trusts, as well as local authorities. Next slide, please. But what we're trying to do is have local providers. So our Business Health Matters offer, and that's an offer which is primarily available to small, medium enterprises. So for us, that means that they've got under 250 employees. We've got 3 components so far. We've got for those businesses that are operating and have employees that are in Lancashire, we've got a healthy weight contract from Public Health, and that's targeting people, as the name suggests, who've got excess weight. And that's very much about supporting them to look at their nutrition and their behaviours and get more physically active to address that weight in a more sustainable long-term manner. And local providers provide that service on a district-by-district basis. Our second part of our offer under Business Health Matters is the Industrial Strategy Fund Healthy Ageing Grand Challenge. And this is the core of the funding which we've been able to secure to enable healthy screening and promote opportunities for people to get physically active and improve their mental health and well-being through a series of opportunities that people access in the local communities. And we've secured around about £3 million for that over the next 3 years. That project's literally just coming to life. We have trained our second cohort of people who are going to do the health checks, and we're going to run our first cohort in the east of the county over the next month. Our third element of Business Health Matters is about skills and retention of particularly older workers in the workplace and workers with long-term conditions. And as Peter was saying, huge numbers of people who are developing long-term conditions, and that number does seem to be increasing. It may be about disclosure, but some of it is about people who continue to work in the workplace. For ESIF 2.1, we've secured £5.2 million of European funding for that, and that's really to promote and provide workplace health wellbeing champions in around about 5,000 of those across Lancashire over the next 3 years. And again, we're going to be looking to release that offer and get people to engage with that over the next couple of months. Next slide, please, Laura. Thank you. So the Industrial Strategy Challenge Fund, that's one of the grand challenges. It's such a grand challenge set by government. This is the one that supports ageing society. As Peter was saying earlier on, we know that people are expected to work to at least 72 at this moment in time. We can see that people are developing long-term conditions, and there's a clear crossover, and those conditions are emerging more prominently in areas where there are higher levels of health inequalities, existing health inequalities, and generally lower levels of household income. And the challenge, which has been set by national government and supported by the LEP, is to improve people's working life, a good quality working life, by an extra 5 years. Now, it's interesting, over the last couple of years, those numbers are starting to stagnate, and in a number of areas, particularly although our areas experiencing large hardships, they're actually going backwards. So it will be interesting to see what happens with COVID, but we expect there to be a significant impact. So 5 years, which was set a couple of years ago, that might be edging towards 6 in Lancashire going forward. So our ISCF funding, it focuses on physical activity and maintaining health at work, and those are two of the thematic areas that were set by the Healthy Ageing Challenge Fund. Next slide, please, Laura. So Business Health Matters, apologies, there's a lot of slides on here. It's very much a collaborative approach with Active Lancashire, UCLAN, UK Active and Lancashire Mind, and we come together with a range of leisure service providers and workplace health providers to enable people to be able to access an offer which will improve their health and and working experience within people who are employed. So we're seeking primarily to get people who currently run the gyms and the leisure services to be upskilled to do things like the health screening, which would typically be carried out by GPs and other medical staff, which are incredibly short supply at the moment. And that health screening work, which they undertake, was certificated by UCLAN School of Medicine, and it actually covers physical and mental health. And we're negotiating to get that information dropped into the GP patient record. So it is the equivalent of going to the GP and having a health check. And alongside the health check, we are, as I suggested, we've got a range of opportunities which we're referring people to. Next slide, please, Laura. Thank you. Right. So this very complex slide here illustrates that we have been working very closely with GPs and the ICS. And one thing that we have been doing is ensuring that our intervention sits alongside and supports the work which you get from your GP. So it doesn't replace it, it sits alongside it, and it enables employees who perhaps haven't been to their GP, who would access this health check, to have issues which are of greater concern actually flagged up into primary care to their GP. We've spent a lot of time negotiating with the local medical council to be able to do that. There's also a lot of intelligence that comes out of this. So we're able to work with employers to help them understand their needs at a global scale and at a sector scale. What are the key areas where interventions or changes in practice or policy might be considered to help them understand how they can support their employees better? Next slide. Thank you, Laura. We're looking to target this intervention. For us, we are very mindful that the larger employers, they tend to have good quality retention programs and health and wellbeing programs. They're generally set up well with policy and support. The smaller businesses, 88% of our businesses across Lancashire have got less than 10 people as employees. These are the people which will be primarily focusing on, and then targeting people up to businesses up to 250 employees. Now, the rationale for that is that the evidence says that those are the businesses which are less likely to have the policy, less likely to have the resources, and critically have been most affected by COVID. They've got the least resilience. And in the research that we've done as well, we found that the two key groups that we want to focus on are young people with mental health and resilience issues, who perhaps at the moment are being disproportionately affected by COVID and are unlikely to reach their longer term potential. So that's one target group for us. The second group are the over 50s who've got those emerging long-term health conditions, which if poorly managed because of perhaps poor lifestyle choice, then we are not going to be able to retain them in the workplace for 10 to 15 years. So that's where we're trying to get to. And as I say, this is very much a targeted program. Next slide, please, Laura. So we will be undertaking, as you can see there, quite a few of these health screenings, around about 15,000 over the next 3 years. It will be across Lancashire and they will be in a proportionate manner. We're also going to be doing some screenings in Cheshire and Manchester, just to see if we can make the project work in an urban environment, Manchester, and an ostensibly rural environment, Cheshire. And we anticipate that after the screenings, at least 50% of people are going to receive some form of behaviour change activity, support and plan, which some of that will be dealt with by the programme. So, for example, we've got the mental health provider, Lancashire Mind, who's providing workplace first aid and one-to-one counselling and group counselling. We've also got leisure service providers who, I said, are going to do things like healthy weight programs, looking at also things like improving mental health and wellbeing through exercise, and improving cardiovascular well-being as well. So a number of programs there. But we've also got funding to be able to refer on to third parties, because we recognise that a number of health issues are a result of things like housing issues, issues to do with, as I mentioned earlier on, insecure employment, debt, and a range of wider lifestyle issues. So they'll be referred on to other partner organisations. The initial intervention will be low cost or free. And by low cost, we're seeking for the initial package of support, which would be the health check and between 6 and 12 weeks of support, to cost about £99. So we're trying to make it as accessible as possible and utilise that funding from the ISCF and from the European funding to make that happen as effectively as possible to maximise uptake. Thank you. Next slide, Laura. So the key thing for us will be about learning how this project can be successful and can be sustained. So one of the key things that we are seeking to do is understand what works, what businesses are able to contribute in terms of funding and resources to actually develop their own workplace offer. And critically, we're working with UCLan Management School to actually determine what are the health economics of this. So if we improve the health and well-being of our employees, what does that contribute to Lancashire's economy? What does it contribute towards the viability and the resilience of businesses? And what does it mean to individuals on a beneficiary by beneficiary level in terms of their quality of life? So we're spending around about £350,000 on that evaluation to produce that evidence base, which we hope we're going to be able to use as an argument with both the LEP and the ICS to secure future ongoing investment into workplace health. Thank you, Laura. So I will just talk now about the workplace health champions. So up to now, I talked about the benefit for individuals, beneficiaries, but we're also offering this programme, as I say, to train up 5,000 workplace health champions at level 2 and level 3. There'll be no cost for this. And this is, again, about supporting SMEs to develop that leadership and that resilience and that understanding, and have some capacity and some skills within their teams to help them on developing their health and wellbeing offer for their employees, and start to develop their own in-house provision, which may include things like the development of policies and programs and just regular activities for their staff and employees. Thank you, Laura. So as you can see there, the numbers are quite considerable. We will be focusing on, as you can see, supporting around about 5,000 participants, and we will be targeting people, particularly from the ethnic minorities, who we know, particularly from the research, experience some of the higher levels of health burden, particularly with COVID, and are more likely as a result of that to drop out of full-time employment. Thank you. And similarly so with people experiencing disability. Thank you. So these are it's very much a skills and capacity building opportunity. So there will be level 2 and level 3 courses. And again, we're going to be focusing on women as well, just to really increase the level of resilience amongst the female workforce, who in some cases are more neglectful of their health and wellbeing. Thank you, Laura. Okay, we've developed quite a significant team to support this as Active Lancashire. The business engagement work will primarily be undertaken by the 2 chambers of commerce. We're just negotiating and finalising that contract with them now, and we will have a business engagement officer who they've just started with us, a lady called Gemma. So I will make the contacts available to the group after this session. Thank you, and that's the end of my presentation. Thanks, Sandy.
Thank you very much, Adrian, and good job. The 9% held out on your battery.
Yeah, good.
Excellent. So maybe I could ask everybody just to come back on with their videos, all the presenters to come back on that are still available, have battery life, and just open. Well, actually, first of all, Annie, I guess I did cut you slightly short. Have you got any? I can't hear you. I don't know if you're muted. Can everyone else hear you?
Yeah, I've seen. I am short, so it's all right. I've actually sat on 2 cushions to make myself look a bit taller.
From your mental health background, you've obviously seen what Blackpool Transport have done and what Adrian's is proposing. I just wondered if you had any comments on that in the light of your presentation.
I've actually put some comments in there because I've met Adrian before, so I know their work is fantastic. I think sort of the thing around Vicky is obviously those ambassadors. There's actually other programmes of work going on in on the Lancashire and South Cumbria around orange button holders, and they're essentially people that are trained to have conversations around suicide prevention. And Vicky, if you're still on, those 70 ambassadors would be perfect, and I can try and talk to Vicky, another Vicky, about getting them trained. And I think the thing for me, I think what's really interesting about Adrian's is that actually a lot of the toolkits that are in the resource pack, the resources that I put in the presentation, might be a little bit overkill for some small businesses. But I suppose part of it is just kind of doing what you can with some of the key principles that we've all talked about. So doing one of the business of the community toolkits, you might just say, oh, I don't think so. But there will be some ideas. So there's definitely something for everybody, and you've got to make it work for you. And I think, I think that's what you were saying, wasn't it, Adrian?
Absolutely, yeah. I think you've got to see it as part of a journey, and we've got to find different touch points and a range of different solutions. I think the other evidence, we actually did some consultation with 400 businesses, and there's a lot of skepticism around this. And so, yeah, you can have a brilliant argument, but unless someone actually introduces the opportunity in a credible and accessible manner, it's just not going to get off the ground. People just not going to engage.
You need somebody to lead it. You need just need one person.
Part of it.
Adrian. So you just need one
person.
No,
you're absolutely right, and that's where the workplace health champions.
That's it.
Yeah, and the other thing is that the big partner networks that have got subcontracts or relationship with other bodies. It's about influencing behaviour, isn't it? Peer-to-peer behaviour.
Yeah. It's not. I don't think it's easy if you're just starting off thinking about it, but the benefits. I think are kind of worth it in the end. I would say.
So absolutely, I think that again, the businesses that we've spoken to, particularly during COVID, they recognised that their staff, they were at huge risk of losing them. And again, we've done research with over 50s who've bought a dog, who haven't been into the office for a year, and they said, we are not going back. We are not going to go back. So there is going to be a requirement to support those individuals to re-engage with an office environment and a team environment and all that dynamics, because they've lost that resilience, they've lost that confidence. There's a huge amount of anxiety.
Yeah.
So there's demand.
Peter, I think you were trying to say something, but I can't hear you. I don't.
Can you hear me now?
Yes. Perfect.
Yeah. Good. Okay. Yes, I was just going to kind of extend that point really to say that I think there is no one size that fits all. We've presented lots of great options today across all the speakers, some of the work that goes on, and I guess you've got to find the one that really fits for you. Hopefully they're good inspiration and you can kind of tailor something to suit your needs. But I think one of the issues to really think about, we hear it so many times, is that when you begin to actually delve into this, when you begin to do those assessments and understand that, initially you may actually see periods where the results go the wrong way initially, and I guess not to be scared about that, because the more you begin to talk about it, the more you scratch the surface, the more these things will come to the fore, and then it may get a little worse before it gets a bit better in terms of actually that baseline and that assessment.
I think you're right, Peter, because I think part of it, people might then think, oh, well, it's okay to have a conversation about my mental health, and I might then think actually it's okay to maybe be sick, but actually in the long term, if you build that resilience, then the presenteeism eventually will go down, and so will the absenteeism.
Can I just ask Michelle? I don't think there are any outstanding questions. Is that right?
Hiya. No, there was just one question earlier. I think it was for Peter, just regarding to the data that you're presenting. Somebody's asked, does that include Blackpool? Because I think you mentioned Lancashire and North West, and sometimes Blackpool's excluded from those figures. Is it a catch-all?
In this case, yes. I would have liked to have presented a Blackpool level data, but that particular piece of work we did only focus down to Lancashire wide. So yes, it does include Blackpool in this case. Yeah.
Thank you. And I don't think we've got any others, unless anybody wants to very quickly add a question. I think everything's covered.
Great. Would any of the speakers like to add anything before we finish?
Just say thanks for your time. I really enjoyed the presentations and the discussion today. It was a really good session. So thank you. Thanks for having us.
And well done, Adrian, for doing it in your car.
that 9% battery.
Thank you.
Going
Yeah,
strong,
it's
that's
a long
impressive.
time.
Yeah, it's still there. I can't believe it. I've just got one other comment really quickly, Andy, and that is that the local industrial economic review, they're going to do a deep dive on health, and so I do think it's imperative that people feed into that consultation. It's coming. They just need to connect with it. But thank you.
No, thank you. Thanks everybody for your time today. Thank you for the presenters and the detailed information they've shared. I found it very informative, and hopefully everybody on the call has enjoyed the webinar. Michelle and Laura will send out more details with the recording afterwards. And as I say, I can just remind you, if you please can fill out the survey at the end, that would be excellent. Thank you very much.
Okay.
Thank you.
Thanks for organising it, Andy and Laura. Thank you.
Yes, thank you.
Bye.
Bye now.
Thank you. All the best.